Hello and welcome to Healthy Living. I'm Dr. Donald Pelto. Today I have Mr. Tracy Winchester with me. He has been dealing with orthotics since 1984, and we are doing this program not at the studio as we normally do, but we're doing it via Zoom. So Tracy, once again, I'd like to welcome you to the show.
Hi, thanks for having me, Dr. Pelto. It's a pleasure being here.
Yeah. So we got in interaction with you because you guys are our main provider for orthotics at this time, and you work for a lab called Forward Motion, and you guys specialize in making custom foot orthotics. So for those that are watching this video, what is a foot orthotic?
Well, a custom foot orthotic is where you see we work with podiatrists only. So you go to your podiatrist. He makes a cast of your foot, either using biofoam, plaster splints, or we have our own scanner that the doctors can use as well. So when we receive those impressions, we make a customized cast to each patient, and then depending on the diagnosis, that would determine the style of orthotic that we would make.
Yeah, and you guys have this great new technology. I think the reason we switched to you guys, and there's a lot of different labs out there, and they make a lot of really good devices, but you have this great scanner where you can actually use an iPad to scan the bottom of the foot. Pretty cool technology. Has that been around that long?
No, not. I mean, the scanners themselves have, but originally they weren't very accurate as far as the measurements that we would get from the feet. And so the version of the scanner we use using the structure scanner is we developed our own software for that. We were one of the first labs to use the structure scanner, and our own programmers developed the software that goes with that program. So we've probably been using that since 2000, probably 15. And it's a great way to go. It's very accurate, and we're very happy with it. Yes.
Yeah. So, but you've been doing this for a lot longer. As we talked a little bit before, you've been helping to make orthotics since 1984.
Yes.
And
it's changed a lot.
It's a lot of orthotics. So tell me how you got interested in doing orthotics, how you got interested in making them, and how things have changed over the years.
Well, I was fortunate that the first lab I worked with was owned by a couple, and that they now have a biomechanics school in Indiana. And so we were owned by a doctor, and so when my first job making orthotics was making fiberglass orthotics. We would literally get the fiberglass and make it to the cast of the feet. And also I used to do acrylic heels, which I don't know if you were around when they used to use Router, but it was a type of plastic, and we would use like denture material to make the heels for the orthotics on them as well. So everything was poured with plaster, all the casts were hand corrected, and so it's changed a lot since then as far as materials and methods we use. Even some of the philosophies, a lot of doctors used to like to use the root style of correction on cast, which now you can kind of tell a doctor's age if he asks for a root style as far as that old-fashioned kind. So what originally interested me in it, I was always liked the idea of that orthotics were a science and an art. So you have to use your head when you're making them, but you're also creating something with your own hands. And so to me, that was always really fascinating. And then the other half of it is I like to do a job where I know at the end of the day that somebody's going to feel a little better health-wise, and that's a big deal. I mean, we're not going to save anybody's life, but we can sure help their quality of life a lot. So, and I really enjoy that. I take that really serious.
Wow. And in terms of the orthotics themselves, how have they changed? Are they easier to make now? Are they harder to make? Does the technology, are they any better than they were before in terms of, can they solve more problems now? Or is it really just new technology to the same old understanding?
Well, I think both. I think since I've started, there's been a lot of different doctors that have come out with different styles. Blake, like the PTTD style of orthotics with the rear foot modifications. There's been a lot of different thinking about different biomechanical ways to approach a problem. Yeah. So for me, that's been real exciting. And then, of course, the materials. Like I said, we manufacture our own shell material, and it can be as rigid as polypropylene, but it's also maybe anywhere from 1.5 to 2.5 millimeters thick. So they're a lot more lightweight. They're just as durable, and they're thinner too. So that also helps with shoe fit and patient compliance. If they can't get something in their shoe, they're probably just going to put it in the closet and not wear it. So it's been really interesting watching this through the years on how things have changed. Yeah.
And in terms of the materials, for those that are watching, they may not know what the difference between a custom orthotic, which you make, is, and something they can maybe buy over the counter. Are they the same things? How are they different?
Well, our lab does sell prefab orthotics. And so for just generic foot problems, a little bit of plantar fasciitis, or even more importantly, like you work on your feet all day, right? So you just want something in there that's going to give you a little cushion to make your feet feel better. And the over-the-counter styles, they're okay for that. But the custom, it's more in depth, right? There's a whole lot more that goes into it. So the arch heights vary, the widths, the materials, like I said, depending on diagnosis. And also you have a lot more choices as far as accommodations. If you have ulcers or calluses that need offloading, metatarsalgia, forefoot pain with the different pads and things that you can add to them as well to accommodate for those things. So, the custom are just way more in depth. They're made to your foot, and so, like I said, for somebody that's on their feet all day on concrete, then they just want something for cushioning. That's okay. But to me, like I said, if you're looking at plantar fasciitis or some of this other things, a custom orthotic is definitely superior to that.
Yeah. And in terms of the style or the method of either scanning or plaster, in your opinion, because we did plaster for many years, or the STS socks, and now we're doing the scanning, we still feel kind of that some patients that have a really flat foot, we still like to do plaster. What are your thoughts? Do you get the same type of a device when you make it with scanning or plaster? Is it easier on one end or the other? How does that work?
Well, I would say that the scan is good for probably 99% of patients. The good thing about a plaster cast is sometimes with the scan, it's hard to get the patient in neutral as far as their positioning their foot. And so, and also, like you said, with those flexible flat feet, with the arches bulging out and things like that. Sometimes a plaster cast is a little better than that. Our scanner is pretty accurate. And the good thing is too that now on our software, if you take a scan and we see it's something and we feel that it needs a special modification, we can mill the raw foot from that scan. So we get the exact same thing as if you were going to pour that cast into the plaster or the biofoam. And so then we can just make that out of plaster then, and we can do the modifications by hand as well. The biofoam, they're okay if you're looking at like a diabetic style. You want to get some weight bearing on there. Sometimes when people aren't weight bearing and you do a cast, their deformities don't quite show up the same as when they are weight bearing, because a lot of things happen to their feet when they stand up. So I'll recommend the biofoam sometimes for people like that. If you have chronic ulcers, Charcot feet are really good for a biofoam cast as well.
Yeah. And then in terms of there's a lot of different diagnoses, or that you have some diagnosis specific orthotics. So
Yes.
one would be like the posterior tibial tendonitis or a real flat foot. How accurate are those? Can you just like check a box and you guys make it? Or do you really need our recommendations as podiatrists, or can you just see the scan and do what's needed?
Well, I always like to get as much information as I can about this patient and the diagnosis. Just looking at a scan, like I said, sometimes, especially for those PTTD feet, they look so different from weight bearing to non-weight bearing. And so if we see the diagnosis is the PTTD, number one, it helps us look at the foot and determine exactly how we're going to approach the cast. And the second thing is also it helps me as far as like if I read a diagnosis and I don't feel that the doctor selected the proper orthotic shell or the proper grind style, the order entry people, they have like red flags. So if they see certain diagnosis, they flag those, and then we go over them to make sure that it looks like what the doctor's ordered for that patient is the appropriate device. So that helps. Like I said, the more we know, the better off your orthotics are going to turn out.
Yeah. Now, in terms of when a doctor makes a device, how often do they need to be sent back for modifications, or what are the most common reasons for them not feeling comfortable for the patient?
I would say the number one adjustment is probably the arches. It's hard to bat 1,000 when you're dealing with custom orthotics, right? So I would say our percentage of arch adjustments, especially from the scans, is probably 1% at the most. So we do a pretty good job on it. But like I said, when you stand up, things happen to your feet, and so we're pretty good at the our arches. Another common adjustment would be like the shell material. For plantar fasciitis, we normally go more rigid. Sometimes the patient gets them on their feet, they can't tolerate that rigidity.
Yeah.
So we'll do a remake into something less rigid, more semi-rigid. Or the other one would be like forefoot modifications to offload ulcers or calluses. Sometimes, going by the scan, it can be difficult to place. We're usually pretty good at it, but you never know. Sometimes they stand on it, and even being like 4 to 5 millimeters off, that doesn't sound like a big deal. But when you're standing on something and it's not right, then it is a big deal to the patient. So yeah, those would be the most common adjustments we probably do.
And then if someone needs it, they just send them back to you and you guys make those adjustments?
Yeah, well, we prefer to go to the they go to the doctor. We normally don't deal directly with patients.
I'm sorry. Yeah. The doctor would send them to you.
So go back to your doctor, discuss with him what's going on. And yes, that's another reason I really like our lab. We have a 6-month free adjustment period. It doesn't matter if it's something we did wrong, if the doctor ordered the wrong shell material, whatever the reason is that it has to be fixed, we're more than happy to accommodate the doctor and the patient. That's our goal. We want everybody to be happy.
That's great. Now, I want to ask about maybe some future ideas with orthotics. Do you think there's ever going to be a time where in an office of a doctor, they could just scan the feet, make it, and they would mill right there? Is that something that, I know they have some, I just don't like the way they look as a finish yet. Yeah. The finish really isn't that good. What are your thoughts?
Well, it depends on how much the doctor wants to invest. I guess the one advantage, just doing like if you were going to make one for, like, let's say it was an accommodative style, you're not looking to make anything really rigid. You're more or less trying to offload a certain area of the foot or something like that. Probably that would be okay. I think the value of the lab is we have trained people. We know how to set the foot to neutral and do cast correction before they're milled out, because you have to compensate for fat pad expansion when patients stand up, the arch modifications. So probably even if you had like a 3D printer in your office where you could just print the shells, I could still see a place for the labs that you would send that image to the lab and they would do all the cast correction on that image and then send it back and you could print it off. Right now, the 3D printing technology is not really up to par as far as what we can do as far as shell materials and things like that. I'm sure probably within the next 20 years it will definitely improve, but we've tried 3D printing and we can make semi-flexible or semi-rigid orthotics, but the functional style and that kind of thing it just doesn't work that well yet. So I think that's maybe on the horizon, but like I said, I do still see a place for the labs when they do, if a doctor ever does get a 3D printer in their office. And then, and besides that, a lot of doctors, old timers used to have like a little lab in their back room at their practice, right? So it might be kind of like getting back to the original, the way podiatrists did something, right? Yeah. So, but most doctors, I don't know. I think they'd rather spend their time seeing patients than running a 3D printer. So, it just depends on the doctor and what they see value in, right? So, but I think, like I said, the labs will still have a place as far as being involved in that process.
And now that's for preserving you as a lab. Now, as for me as a doctor, do you ever think there's going to be a point where you could go to a website as a patient, do a picture, or I don't know if a computer could do a 3D scan ever, but doing it of your foot, and it would go to a lab like yours, and you guys could make a device where you can just kind of put in what type of foot type you have and things like that, and make a device. Do you think that's going to be on the horizon?
Well, that part of it I'm kind of skeptical about. Like I said, some of it I wouldn't mind doing that. But the reason that I like going through a doctor to do this, they're a trained professional. And so something that a patient might not understand, or the root cause of what's behind their foot problem, that, like I said, if you just want something because your feet hurt because you stand on them all day, you can already go buy an OTC, right? And so I really don't. I like dealing with doctors. They're trained professionals. And so when you're dealing with a custom foot orthotic, I would much rather not rely on the patient for the information and what's wrong with their feet, because most of them don't understand biomechanics and pathology. And so it makes it difficult. To me, it would make it difficult to get the outcomes that we achieve by working with podiatrists.
Perfect. Yeah, I agree. But I always like to just ask the question.
Well, like I said, I think that like I said, if you could order like an OTC style made to the correct width and arch height. But as far as if you really have a serious foot problems, you need to go see a doctor. They're trained to take care of those things.
Now we're going to show those that are watching the show a couple of kind of pictures and videos. So if you could just kind of walk us through what they're going to be looking at in some of these videos or pictures that we're going to be showing them.
Okay. Well, first, we'll start out at the beginning. We receive 3 styles of cast, a plaster splint or an STS sock, as you were referring to earlier. And we also get in biofoam, which is, the compressible foam. And then we also receive orders over the scanner. And so either way, we're happy to make orthotics no matter what kind of cast we get.
And then you take that information, and then what's the next process? They're milled, I think. Is that what you?
Yes. Then next, what we do is, unless it's like we said, one of the PT, TD types of devices or a Charcot foot, we will pour those for the plaster in the plaster cast, and for the scans, we'll just make a foot and we'll make a cast from that foot to make the orthotics. But for 98% of patients, we will make a digital scan of the foot, just like the doctor's taking in your office. Then we will send it to the correction software, And from the correction software, then we will modify the foot. Like I said, we add expansion on it. We modify the arches. We set points on the feet for lengths and widths. And then, yes, we send it to a CNC router, and that will make a cast that we will use to press the shells on.
So what, for those that don't know what a CNC router is, what's a CNC router? Is it cast correction? Is that what that is?
Yes, it's what we use to make the cast. So after we get done using the cast correction on our software, then we will mill that out on a board. And so it comes out just like either wood or foam, depending on what we're making. And then from there, then we use that as a mold to heat and press the shell material onto the cast itself.
Great. So once the shell material is fabricated, then come all the kind of the posting and adding the different modifications in addition. So what are some of the posting, you guys do that as well with a computer, or do that by eye?
No, the shells that we use, that we manufacture, we can't put like a big polypro block on there and mill the shells directly from the polypro. Some labs do that, and that's fine. But with our shell material, like I said, we're kind of going for lightweight and thin. And so we make the cast, we mold them. Most of the heels are made from a hard crate material, like a rubber material. And then we grind the shell to shape of the foot, depending on if there's any type of flanges or anything like that asked for. Also, the posting instructions, if there's a rear foot varus or valgus, we'll compensate for that as far as in the posting of the shell. And then, we give them a nice polish and finish so everything looks really nice. And then from there, they go to the finish department, and that's where we add the covers, pads, any type of accommodation offloading that the doctors ask for.
Great. And let's say someone does get a pair of custom orthotics. How long can they expect them to last? What are the common, they do fit? What are the reasons maybe they would wear out sooner or crack or things like that?
The shells themselves, they should hold their shape for, a while. It's a natural thing for every plastic. The plastic we use, it doesn't deform as fast as polypropylene would, but still over time, the arches are going to drop a little bit. That the shell material itself, as far as breakage, they should never break. And so all of our orthotics have a lifetime warranty as far as that. Normally it's the covers that wear out before anything else does. And so depending on what kind of top covers that you have, they should last anywhere from like a diabetic style top cover, the real soft, might last 6 months to a year, where the vinyl and neoprene and that kind of thing, it should last at least 2 or 3 years as far as the padding and the top covers. So that's usually the first thing that wears out is the coverings on them.
Yeah, and those are pretty easy. They can send them back and be re-top covered pretty easily, right?
Oh yeah, that's an easy modification, and it's usually really inexpensive. So
yeah, and then finally, as we finish up, in terms of kids, there's a lot of kids that grow out of orthotics. And do you really want to put a kid in a custom device? Can they just use over the counter? What type of accommodations do you have for that?
Well, we do offer an OTC device for children. And so but that's not usually, they're not as popular as the ones for adults. Normally for those, if you have in-towing or out-towing, those need to be kind of a custom thing. The UCBL styles with the high flanges and everything. So, and usually, like, our lab offers an outgrowth program. So if the patient wants to purchase that, it's like insurance against your next pair. Yep. So, kids their feet are going to grow. And so sometimes they outgrow the need for orthotics, and sometimes they're going to need them the rest of their life. So it's kind of the practitioner's call as to how he feels that they should approach that. But finding a good OTC for kids is kind of hard. So, but we do offer them. But like I said, normally if a child's bad enough to where they feel they need orthotics, then the custom is usually the way to go.
Well, great, Tracy. I think we covered a lot of ground here. If people want to learn more about forward motion and kind of learn about you guys, where would be the best way for them to find this information?
Okay, our website is fdmotion.com, and so anybody can get on there and check it out. And but you can't order anything from our website. You have to be a podiatrist to utilize our services. So if you like something you see, I would recommend give Dr. Pelto a call, and he'll be happy to fix you up. Okay.
And I'll fix you up. Well, good. Well, thank you so much, Tracy. Any last imparting words or anything like that?
Thanks for having me, and thanks for the opportunity to talk about my lab. And I would just like to remind everybody, like I said, if you're having problems, some things, go see a podiatrist, okay? Because I've dealt with lots of different doctors in lots of different fields, but as far as I'm concerned, podiatrists are the most qualified for prescribing and dispensing orthotics. I think that's the only thing they're worried about is your feet. And so I really enjoy working with the doctors. Yeah, so if you got foot pain, go see your podiatrist.
Great,
okay?
Great. Thank you. This is Tracy Winchester from Forward Motion Orthotics. Thank you, Tracy.
Okay, Dr. Pelto, thank you for having me on.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.